So, I've been here before. It's kind of nice to see you guys here. There are more students here than there were in the 7:25 a.m. class yesterday. So, today's paper is Vaccine Court Keeps Claimants Waiting. Okay, so what does that mean? There are a lot of people that are claiming that the vaccines cause problems. Okay? True, vaccines cause problems. We'll go over a little bit of them. And at the same time, vaccines save lives, they save money, a lot of different things they're good for. So I'm going to go over, I'm not going to preach to you, but I do preach. I'm not going to proselytize, but I do. You have to forgive me if I really give you some hard data and some gross information, but I can't make people go get vaccines. Today I was talking to 3 of my students who are working, they're undergraduate students. None of them had gotten their vaccine yet against influenza. Right in the lab next to us, a student, she's supposed to go to a meeting out in Oregon. She came down with flu, okay? So, you know, information is one thing, and I can stand up here and give you facts and so on, but people making decisions, that's a very personal thing. And one interesting aspect of deciding whether or not you want a vaccine is your mother. Believe it or not, we've done some studies on that. And students talking to their mothers are more likely to get a vaccine than listening to me talk about them. So, yeah, I'm pretty realistic about this. But if I can convince some of you to get vaccines and know why you get the vaccines and what are some of the side effects of vaccines, that's good enough for me. Okay, so vaccination is an act of love. It's free here in Alachua County to children under 18. Every day, kids are vaccinated, okay, against 12 diseases before the age of 2. Okay, so all of a sudden, parents got a big investment in their kids, okay? At least 9 months for women. Guys, a little bit shorter time than that, but after that, then we're paying for a long time. So here's a bad statistic. 1 in 4 children in the state of Florida is not fully immunized, okay? And I'll show you an example, and if you are immunized, there's some problems. But fully immunized is, I think, part of the issue here. They're safe, and we're still looking at what's going on with vaccines. Okay, so people die every day, okay? And here's what happens in terms of people dying per year, something like that, I guess. Infants die. Children die at birth. Okay, so now we can get into controversy. That's about 20 to 40 per day die. Okay, so during that time when they're children, you know, very young, okay, and they get vaccinated, all of a sudden you're going to blame anything you can other than it happens, okay? It happens that people die. So you're going to see young kids before the age of 2, as I said, they get vaccinated, and then all of a sudden, well, they got vaccinated, okay, and then something happens, okay? Well, yeah, but what causes it? Now, that's the issue of education, and that's why you guys are continuing your education, learning, and so on. Okay, you're experiencing things, and you see things happen. Well, what does this rich guy say? So it's an absolute lie that vaccines have killed thousands of kids. So the people, how come we don't have a bigger picture here? Okay, who are saying they want anti-vaccines, they're the ones that are involved in killing children. So you're convincing people not to vaccinate. And so what happens if they die? Not my fault, you know. Well, maybe it is. So that's why facts, okay, and who's at risk and why. It's not just, okay, yeah, sometimes if you do get a vaccine, you're going to have some serious side effects if you're immunocompromised. Okay, so you got to know a lot about your own health. Okay, so you just can't blame the vaccine. So there's lots of vaccine controversies, and yes, CDC has stuff. There's autism. New England Journal of Medicine is one of the best journals in medicine. Okay, and so they publish a lot of information on it. Here's some more. Again, I like to look at those for real medicine-based evidence. Okay, and that's what I think you want to look at. And then there are things about thimerosal, mercury. I should be dead if mercury causes problems. I ate a lot of candy when I was a kid. Dentists should be dying, because you're in there drilling, and dental hygienists, they should be dead. Who would want to go into a profession that you're working with mercury? Okay, well, yeah, there are some problems associated with mercury. The lead paint that had mercury in it causes mental retardations, but not autism. Okay, and then there's some other things that are going on around the world. There's polio in the world. There's chikungunya. We were just talking to Allie's brother-in-law, and there's chikungunya. Allie's, let's see, is he a nephew? Grandnephew. Got chikungunya, and he said his arms were broken, his legs were broken to his teacher. That's how bad viruses can be. Cholera. Okay, I've taken students in Cuba. We were down in Dominican Republic, and right across from here to the door, a person had died from cholera. Okay, Haiti, cholera. Cholera is actually caused by a virus in the bacteria. Tricky little viruses, huh? Okay, so is vaccination linked with autism? Yes, in the news media, it's linked with it. And you can say anything you want in the news media, and you can get a whole bunch of people following you, okay? Oh, man. But there have been all kinds of studies. I cropped out a bunch of information on it, but there's no links with autism. They still have studies going on called SEED studies. But you can see, trying to prevent 16 diseases, 33,000 deaths, 14 million illnesses per year by vaccination. So we're actually doing a good job overall in terms of health care. And again, reject a causal relationship between thimerosal-containing vaccines and autism. So what's the story?
Wrong resolution.
These IT people like to blame me all the time.
No. No blame.
Yeah, so at the university, they record stuff to have distance education. They don't record. So I'm used to this, being interrupted and having difficulties and not being able to hear me. This is normal for me.
Hopefully not so normal for
Believe it or not, if you want to be a good teacher, you got to learn to do all this stuff.
That's good.
Got it?
Yep.
You're back.
Is that it? Yay! That's why we need IT people. They know it, and I don't. Okay, so yeah, like I said, there's no link between autism and vaccines. In fact, recent information shows it's developmental. Your brain is developing at that point. But parents like to blame something, and like I said, the time is right. Okay, so I get emails from students. This was not a very good one. This is somebody who is going into a certain field. I won't castigate, but you can see spelling errors and so on, and she wanted to know about vaccines. Good sources of positive information about the HPV vaccines. Some of my friends, here's a great source of information, isn't it? Free, it should be feel that the vaccines itself might cause infertility. Well, I've seen this in third world countries, you know. Some clerics will say, well, we're trying to sterilize women by giving them measles vaccines. No. And other bad effects, okay? So have any information about it? Yeah, I get lots of information. And little boys can lead to autism. Why not girls too? Okay? Just because you're deficient X chromosome. So anyway, I had a hard time giving her input here. Okay, so right away you can see she probably doesn't have very good friends, not very well informed either. So that's why I like to give information. So here's a schedule of not only viral vaccines, but they're also bacterial vaccines, pneumococcal. I just had that one. Inactivated poliovirus, okay, IPV. Until about 1992, they were giving the oral polio vaccine, and people were getting polio from it, but very few, I think 6 per year, whereas some of my friends when I was a kid had polio. 3 had polio in my department alone, okay? So you can see, here's one that a parent would not like at birth, okay, giving a vaccine. Boy, would that be frightening. However, if the mother is hepatitis B positive, you better give the vaccine to the kid at that particular time. Otherwise, the kid's going to get it for the rest of their lives. It's chronic. Actually, there's some real strong antivirals you don't want to give kids. So you can see, yeah, the schedule very early, a lot of different ones. But then you can see there's some that are later on, okay? Measles, mumps, rubella, varicella. And these are mainly because they're live attenuated, and prior to that, you're going to be nursing your kids and the vaccines won't produce enough antibodies, memory cells. So yeah, you got to wait for the live attenuated vaccines. Okay, and then for you guys and up, you can see here 19 to 21 years old, get your flu shot. Varicella, if you haven't had that. Again, Ali's brother-in-law was saying that a 30-year-old person had never been vaccinated against chicken pox and never got chicken pox. He was a kid, got in the brain, person's in a wheelchair now because of chicken pox. My brother, when he was going to medical school at UF, he didn't get chicken pox. He's 7 years younger than me, okay? And so he was so sick, he was in bed for 3 weeks. They kicked him out of the medical school during that time. So you don't want to give chicken pox to somebody. So it's definitely a serious one. HPV for both females and males. Okay, so this is a very important one. Zoster for us old folks down here. For shingles, measles, mumps, rubella. Okay, and then hepatitis A and B. Good reasons to get vaccines. Okay, so parents. Parents get real upset when their kids cry. And so you can see a kid was born about March 2nd. And 2 months later, 1, 2, 3, 4 vaccines. Okay? Well, took 2 nurses and I think the mother and the father to hold down the kid. And they go, bam! Bam! The kid was crying and the dad was crying. That's me. Okay? And then a couple months later, the same thing. 1, 2, 3, 4. So a lot of people, when their kids are crying and bawling and they're pretty upset, they won't go for the whole series. Okay? Can you blame them? I mean, this is a nice little daughter. You don't want to hurt your daughter and you're just, boom. They were pretty rough about it. But anyway, there are a lot of vaccines that you get, as you can see. So teens and college students, yeah, okay, you're still recommended, okay. Meningococcal, okay, this one is is very important. It's required at a lot of universities now. We used to get 1 or 2 students per year die at the University of Florida. One at the University of Central Florida, a week or 2, came down with meningitis. You can die in 4 hours from the beginning of symptoms to death with meningitis. That's why they're so adamant about this. It's a bacteria. Okay, you can get meningitis from viruses, but the bacterial meningitis is deadly. Okay, so there are quite a few there, and again, adults, we got a whole series for that. There are some contraindications, as I pointed out, when you not get certain vaccines. Pregnancy, okay, HIV, and depending upon how many cells you got. So varicella, that means it's going to be chickenpox. It's a live attenuated vaccine, but it can disseminate, it can spread around your body if you don't have an immune system. Same way with chickenpox here, for zoster for older folks, measles, mumps, rubella. Okay, so not only HIV, people get transplants, immunodeficient, any of those contraindications. So when somebody says, well, they got a vaccine and they died, okay, what was the underlying cause? And it's not so uncommon when you're vaccinating millions of kids per year for something to be deficient in their immune system. Okay, the other thing is people travel around the world, okay, and CDC has a very good information on that. Our health department will drive you crazy with information. I've been teaching this for decades, and the woman, I said, I know about it. I know this. She just droned on and had little kids. It's like, just give us the vaccines. No, we got to tell you every detail. I know them. I teach it. So yeah, but you can see polio is still out there. Okay, not only is it out there, but people from other places bring it back here. Chikungunya is out there, again, cholera. So there's good information on what to do when you travel. Yellow fever is required for certain parts of going to Africa. Okay, so you got the physicians going to Africa for Ebola. We got Central America and South America, there's yellow fever. However, in a few cases, people die from getting that vaccine. It's a live attenuated vaccine. It was the best vaccine I ever got. I was up at Yale, and we were working with yellow fever. They go, it's as simple as a mosquito. It was incredible, nothing else, okay? So it's a great vaccine, but some people have reactions to it. They're not all perfect. But starting way back in 1700s, vaccines, smallpox. In fact, China was using some scratching on people's arms for smallpox way back, probably 900 or so. Pasteur, rabies, flu's pretty old, yellow fever's old. So we got a lot of vaccines, and now we got some more. Okay, so we're still working on vaccines. Here, 1 million people per year would die from rotavirus. Okay, and fortunately we got some for sexually transmitted diseases too. Here's one that's taken off the market. And I like to compare those two because when you're doing experiments, you got controls, and you got those that you're going to actually vaccinate or treat with medication, whatever. Turns out, companies can be cheap. So they didn't have that many controls. They had that they vaccinated. 25 people that were vaccinated had blocked intestines. Okay, so if you have a small group of controls, say 1,000, and 2 people get blocked intestines, but you got 10,000, 100,000 who get the vaccine, and 25 now get blocked intestines, you're going to say, well, it's a vaccine. But had they had more controls, it's expensive doing experiments. Okay. There's one other thing, okay, and this is related to Ebola, but it's also for other diseases, and that's using immunoglobulins from people who've recovered from diseases, whether it's chicken pox, okay, or cytomegalovirus. We had one woman who was cytomegalovirus negative, and she donated blood for bone marrow transplant people, which means she didn't have the virus in her blood. Okay, so she was good for that. But then there are other people who do get bone marrow, kidney transplants that need antibodies from people who have had cytomegalovirus, but the virus is removed. Same way with hepatitis. Rabies, of course, that's one. You've heard of people getting antibodies for that. Hepatitis A, measles, okay. This is one also when you have travelers who come to the United States and you have a group of people who have not been vaccinated. Not only they vaccinate you, but they'll also give you antibodies if you begin to come down with it. This one is vaccinia. People are doing research on it, and it's a pretty bad virus if it disseminates because you have an underlying cause, eczema, okay? So it can cause necrosis of your skin, okay? You can get in your eyes too, so there are some bad effects. The military, they're incredible in terms of vaccination. You can see all of those that they require depending upon your service. This guy right here is obviously getting flu mist, okay, so he's relatively young still. So when I was a kid, this was very common to see iron lungs, okay? This is me at the CDC, Atlanta. And the woman who was our secretary helping out students, when she was a kid, she was in an iron lung for months, I think 6 months. So here you can see how they are. And looking up here, that's how her world was. So we had 3 people, as I said, in the department. She was wearing braces, and others, they had their feet fused, so they'd walk kind of like this because they couldn't move their foot. They'd fuse the bones. So you may encounter people like that and say, why? You know, well, they had polio as kids. And I knew people who, as adults, had to go back into iron lungs. The guy finally died. He was a wonderful guy. So polio is still out there, some bad effects, okay? Afghanistan, we got soldiers there, okay? The vaccine for polio has been so good. We're so close to eradicating it. Just last week or two, an amazing thing. This one right here has been eliminated from transmission. So this one and this one have been eliminated. This is the only serotype left, okay, in terms of wild poliovirus. And that's great because this one right here is the one, as I told you earlier, was reverting back because it doesn't have too many amino acid changes in the proteins. And so it would mutate back, as most RNA viruses do, and actually cause a polio. The last polio in this hemisphere was in Dominican Republic, and people were transmitting polio because this had reverted back. Pretty amazing. Okay, so how have we done? We've done quite good. So back 20th century, the 1900s, I guess, not too long ago, you can see how many cases annually, morbidity, severe disease, that is, okay, and now 1998, doing pretty good for most of them, decrease. So the vaccines work. Okay. You guys are lucky. Okay. Again, the mutant polio is the one in Hispaniola, that's the Dominican Republic and Haiti. And it was circulating around and it shed in your feces. And then we get into religion, as I pointed out. And again, the religious people in Nigeria were saying, and again, you look at cases between southern Nigeria, Christian had only 253 measles cases and no deaths, whereas you can see in the north part, 589 victims have died. So that many measles cases based upon not trusting Americans to go in there and vaccinate their kids, okay, just based upon religion. And so, again, as I was talking about, to try to convince people to do something, you got to talk at their level. You can't just go in and say, okay, this is what you got to do. No, it doesn't quite work that way. Okay, so you have to enlist people who will know that they're going to actually protect their people. Chicken pox, okay, there's all the zosters out there. And so what? Here's somebody from Osceola, okay, 3-year-old on a Sunday. She came down with chicken pox. By Wednesday, ill, feverish, that she went to the Osceola Regional Medical Hospital, and she died on Wednesday. 3 days, boom, 3 days. Okay, why? Well, 6 people would get it per year. She had her immunizations, okay, and the vaccine was available, but it wasn't 100% effective. Okay, so this is one of the soldiers that paid her life to tell other people you got to have 2 of the vaccines, the chickenpox vaccines. So yeah, we lose people, we learn something, and from that we go forward. Our son had 1 chickenpox vaccine, came down with spots on there, not a whole bunch. Took him to the doctor, chickenpox, okay? So he's vaccinated with the live virus now. Okay, so it's out there. So yes, you want to vaccinate and don't end up like these people right here. Okay, it's pretty amazing virus. And here you can see in the newborn, disseminated chickenpox. Okay, if the mother had been vaccinated or had chickenpox, she would have been producing antibodies that would have passed through the placenta and protected the child. And it's also in mother's milk, antibodies. Okay, so another morbillivirus, paramyxovirus. Okay, measles is one. You get these little coplet spot. Otherwise, you don't know what you got. You got a rash, all kinds of rashes out there. Fever, yeah, you get fevers, sore throat. It's a virus, right? Well, mumps, on the other hand, that's pretty diagnostic. Okay, so it gets in your glands here. And guys, it gets in your testes. Okay, so if you really want to protect your future, get your sons vaccinated, of course. And when I was a kid, really impressive, I think I was about 11 or so, the old neighbor kid said, I got the mumps, look at me. Pulled down his pants and it was like a gonad that big. It was like, whoa, you're an 11-year-old, here's a big one, you know. I just got it here, here, and then both of them. So yeah, it was very painful. And my smart brother said, here, take this pickle. It'll help the pain. Boy, it hurt even more. Brothers. Okay, so measles, like I said, you get a nice rash. You get the spots in the throat here, the teeth right here. Rubella, measles, mumps, rubella vaccine, you can get that. Okay, it's pretty nasty. The other issue with rubella is I think my cousin had it, and because of that, he had hearing aids, couldn't hear very well, had cross-eyed, so he had congenital rubella. So you don't want that with your kids either. So the measles, mumps, rubella vaccine is live attenuated, and you don't want to end up cross-eyed. Well, okay, so there are people, you say a non-medical vaccine exemption. Okay, I don't know what a non-medical, other than being afraid. Okay, so people say religion. Okay, so being a scientist, I got to find the data. So I pull up the online Bible, okay, and I search for vaccines, viruses, diseases. Nowhere does it say. In the Quran, it doesn't say it. It doesn't say it in any Bible versions. It's not in the good Book of Mormons. I've looked in all of the good books. Nowhere does it say, not even the 10 Commandments, thou shalt not vaccinate. It does not. I did the experiment. Okay, so I don't know what a non-medical excuse is. Okay, because you can get vaccines that are grown in chicken eggs. Okay, and if you're vegan, you got some that are grown in other things. Okay, so there are people that travel around the world, came back from India to Iowa, but they were sick on the plane, and so they go through Europe. Okay, and there was a whole bunch of other stuff I clipped off here, but everybody along the way had to be checked and see if they were getting the measles. It is one of the most infectious viruses out there. If a person came into this room with the measles and nobody was vaccinated, 90% of the people will come down with measles. If this room was filled like this and one person came in with Ebola, guess what? Nobody's going to get Ebola unless you touch them. In fact, Dr. Sykes, I looked up the titer of Ebola because he didn't quite know. It's 10 to the 7th virions per mil. So about 10 million virions in that volume. Okay, so there's a lot in their blood and tears and so on. It's towards the end of death. Okay, so we got people around the world coming to visit us. So here's the mumps before and after. That's kind of like what I looked like. Boy, it's painful. Okay, so again, so most in years is a great vaccine, but there's some, you got to cover everybody, not just you. Post-exposure prophylaxis of rabies. So rabies is very few cases of that. However, there are people, like students, go by the bat house. This happens every couple years. They pick up a bat, get bit, scratch, whatever, and then they got to go through the prophylaxis. This is interesting. There are 2 viruses that you can get vaccinated after you've been exposed and not come down with the disease. One is smallpox, and the other is rabies. Okay? And so it's got a long period. However, again, depending upon where you're bit, if you're bit right up here in the face, boy, you're going to have a hard time. It's the worst vaccine I ever had. Again, working in the arbovirus research unit, next door working with rabies, found, bam, in one arm. They take blood out, see if you got antibody. The next week, bam, the other arm. It was awful. There was, at the third one, my arm just kind of tingled. One other woman, I think she fainted, but she was in bad shape because of the third vaccine. HDCV. I don't like the H part of this vaccine. Human diploid cell vaccine. I got duck embryo. I don't mind getting injected with duck proteins. How many of you like injected with human proteins? Think autoimmune. Okay, autoimmune response because you're going to be vaccinated probably with some contaminating human protein. 5 doses. Okay. So that's pretty bad. And then at the same time, remember we talked about using antibodies. That's called passive immunization. So the Ebola patient, Brantley, somebody had recovered from it. They gave him blood, and he survived. So you get, it's a temporary antibodies, while your body then produces antibodies to the pathogens. And that works. And the Ebola video I show, 7 out of 8 patients in Africa survived because the African doctors did transfusion of convalescent serum, whereas the Belgium doctors, like Dr. Sykes was saying, they were there, it was 1992, don't do that. And so the African doctors in French say, why not? What do you have to offer? Nothing. Okay, so the African doctors were right in that case by giving antibodies from somebody recovered, and that's what happens with rabies. Interestingly enough, I think this is from horses. Did you make rabies antibodies in horses? Okay, so it costs a lot of money. That's the issue with rabies. There are very few cases, but look at this, 40,000 per year receive post-exposure prophylaxis. Okay, and so the Rototec, this is the one, the vaccine that's used for rotavirus. I don't know if you ever had kids. When they get rotavirus, it is some of the stinkiest poop there is. Ugh. It is. It's the worst. My neighbor's kid had it, and she's a physician. She had to take her son to the intensive care unit, even though she knew what to do. He kept vomiting and diarrhea, could not keep anything in him. And for 3 days in intensive care, IV, you know how much money that cost? Tens of thousands of dollars. Okay, hepatitis, we got vaccines against that. Okay, yellowing, jaundice, because it's in your liver and bilirubin buildup. Your urine has a lot of protein in it. Okay, that's a doctor's hand there versus the patient, how yellow that is. Hepatitis, again, outbreak of that. 4 people died from hepatitis A. So I was giving a lecture one time to high school students and their teachers, and I was kind of, you know, hepatitis A doesn't really kill too many people. You know, as a person in the back raises her hand, she's a teacher, said, my daughter died of hepatitis A. I'm going, I really kind of felt small at that point. So yeah, people do die from hepatitis A. Chi-Chis no longer exist. And besides that, you shouldn't be eating onions, okay? Allie and I, that's how we get together. We don't eat onions. So. Okay, so I'll just throw this one in because we talked about polio and the vaccines. So now there's a virus out there, an enteric virus. That means it gets in your stomach, you get diarrhea, you get sick. But it can also cause other issues. And here you can see Staphylococcus aureus, sepsis. Okay, so viruses, once they get into you, they can open up your skin, your intestines, for bacteria to get in. And so if you hear somebody say, well, you don't need antibiotics for viruses, be careful with that. It's not an absolute saying, because here, like I'll show you maybe later on some other cases of that. Why don't they have a vaccine for it? Polio's in the same family. See, so we need some research on this. I think China's working on a vaccine for that. So now let's go into warts. Okay, I always like to talk about warts because when I first started lecturing on them, there's nothing available to do, okay? Skin warts, anal genital condylomas. Okay, so condylomas are kind of like cauliflowers, how I remember it, and that's warts. Okay. So you can get, is that Michael Douglas? He had throat warts, cancer. Okay. Flat condylomas is uterus. Neoplasia, cancer of the penis and anal region. It's very common in gay men. And then the ones for cervical, there are a number, 16 and 18, remember those, but there are others too that cause cervical cancer. Okay, those are about 50% of the cases, 16 and 18. Okay, so I'm going to have some gross pictures here. There's a somewhere, there it is. There's a wart in the back of the throat there. Okay, here's some on the tongue. Okay, so you can see warts here on the tongues and the tonsils, soft palate or the tonsil. So you get little warts, and I got some gross pictures coming up here. Okay, so this is, how do warts get into you? Okay, so you can see up here, this is dead skin. Viruses don't grow in dead cells. Don't do it, okay? So, actually it's down here. As you can see way over here, primary infection, So somehow the virus has to break skin, go through these layers of cells, okay, the spinosus layer, and get down here and begin the replication process. And there's all these little proteins that are involved in it. So I asked a guy about that. How does that happen? So rough sex, so you're breaking skin, okay, opening up, get down in here. So it's got to get through dead skin. Okay, so here's a nice picture here by Dr. Nick Maruniak. He's a pathologist, and you can see down here this is the bottom part, so you got some capillaries, red blood cells down here. But the ones that have the papillomavirus look like this, okay? It's very indicative of HPV. And so in pap smears, that's what doctors do. Okay, they go down here with a speculum, getting part of the neck of the cervix here, putting it on the slide, okay, and they're looking for the koilocytes, those enlarged cells that have white around the nucleus. Okay, so they're looking for this particular pathology associated with it. The normal cells look more like this down here. Okay, and so then you get a pap smear with abnormal cells. That's called cervical intraepithelial skin neoplasia, CIN1. It's no big deal. You can probably clear that if you got a good immune response. Okay, so the doctor says, come back in 6 months, I'll do another pap smear. Okay, normal is like this. So you're looking down here, sperm goes in there, baby grows there, okay? So CIN2, high grade. Now you got to do something with that. Either freeze it, or use podophyllin, there's some other antivirals there. CIN3 is cancer. Then you got to shave that off. Now we got a problem. These are just graphic pictures here. I'm not sure what graphics they are, but okay. So here you can see warts on the labia of a vagina. Here on the penis you can see warts. Warts. Here's somebody's eye. Okay, so then when you start saying, okay, do I need to have sex to get warts? Well, I don't know what you would do that part of it, but you can get warts all. Now these are condylomas. Okay, condylomas. Those are warts. That's not necessarily the neoplasia. But now we're going to talk about, this is the penis. This is cancer right here. Guess what's got to be done? Yeah, so that has to be cut off. Okay. This is the head of the penis down here. That's warts. That is warts, the head of the penis. Okay. And you can see the vaginal region there has a lot of warts. Anal warts. Okay. This is interesting over here, because this is not normally how warts look. What the doctor did is put vinegar on. Vinegar turns warts white. Okay, so this is very, well, you can see here, this is not white, but you put vinegar on, it shows up. And so I got some other pictures, not here, that show that very descriptively. So when the doctor goes in for colposcopy with a woman, he's putting in some vinegar so you can see if they're whitened. It's called acetic acid, aceto whitening. Okay, so that's what's done. So, you know, if you're going to go out on a date, take a thing of vinegar along and check to see. Check, you know. Okay, so yeah, I think I got another gross one here, but okay, so here now, Okay, so here's the opening to the cervix, and the baby is growing up here. Should be growing up here. Obviously, this person lost their uterus. Okay? And up here is where the baby should be, but from here all the way, that's a tumor caused by HPV. Okay? Now, one other thing to note here is this is an IUD. It's upside down. The T portion should be up here. Okay? So if they have an IUD, they're not protecting themselves against sexually transmitted HPV. Okay. So if you're not protecting yourself that way, what is there? Okay, so here's Farrah Fawcett. She was in Charlie's Angels, original stuff. She was homecoming queen at University of Texas a couple of years before I got there. And so she came down with anal HPV, which turned into cancer, okay? And she died from it. And there was a video of her. She went from this, she just, oh man, at the end, she just looked awful, okay? So it doesn't mean necessarily that she was promiscuous. One story. It's an anecdote, so it's not published or anything. So swim team of a particular university, all of them came down with HPV. Well, on benches, guess what? The virus does not have a lipid envelope on it. So those people who go up and get alcohol and wash their hands, that's only for lipid envelope viruses. HPV doesn't have it. It's stable on benches in locker rooms, and you sit down, you leave the virus, next person sits down without their swimsuit on. The whole team ended up with HPV. So you can get HPV from not even having sex, okay? Plus you got to wash yourself, okay? So you go in the bathroom, you open the door, etc., etc. So there are things that you can do. So here, 16 and 18 are the ones that cause cervical cancer, penile, 41 causes penile cancer, okay? But here are the ones that cause the cauliflower, 6 and 11, the condylomas. So this is pretty neat in that regard, that it's not only for cervical cancer, but it's also for warts. Okay, now what kind of warts? I don't know if it's on your hands, in your mouth, the eyes, as we saw, plantar warts on your feet, but nonetheless, you're protected against 4 types. So this is a quadrivalent, 4. They're coming out with an octavalent, and the next 4 were those that also cause cervical cancer. Okay, so they're getting up close to 95% of the HPVs that cause cervical cancer. And then I got to give you information. Okay, it's given 3 injections over 6 months, and if you're under 18, it's free. If you're over 18, insurance may cover it. Okay, if you can't afford it, then Merck actually has a program that will pay for it. Okay, so you got to be poor students, I think, to get it for free. Okay, so pretty good. So post-licensure safety. So remember the student that sent me the email causing deaths? Okay, so here's after the quadrivalent vaccine, okay, by age deaths, 2, 11 to 12, 9, 13 to 17, 9, 18 to 26, unknown. 32 people died, 740 non-fatal serious, 11,000 non-serious total, blah, blah, blah. Okay, so they review them. So in today's paper, I found out why there's so many reported. Lawyers get paid whether they win the case or not for these vaccine-associated events. okay? And yeah, it's held up in courts for a long time. People get paid. The lawyers get paid whether they win or not. It sounds like a gravy train to me, but there are some serious side effects, and some people have been paid off, okay? But then when they look at these things, what really caused the death, okay, there were numbers such as diabetes, another viral illness, illicit drugs, heart failure. So that's what I was saying. You've got to know the cause, okay? Just because they got a vaccine does not mean the vaccine caused it. People, like I said at the beginning, people die every day. Every day. Infants die. 20 to 40 per day die. Okay, so I wanted to do a quick influenza. Before I do influenza, look at this guy. Oh, what does he have on his lip? You think he was stressed? Boom, herpes. Yeah, people get stressed. This is recent, obviously. So, yeah, that's a cool picture there. Okay, so any questions on those before I go into flu? And this is where I'm going to try my best to convince you need to get it. So Dr. Small's 80 years old. He's gotten awards from Centers for Disease Control because he's got the influenza vaccine program. We are #1 in the nation, okay, in virus coverage. So what's happening right now? So we're at about week 45 or so. Look at us. We're more than the other states except for Massachusetts, okay? Georgia's beating us and not getting flu. Okay, so like I said, student next to my lab there had it. So it's here in Florida, so you still have time to get the vaccine. Okay, well what happens? So at about week 40, we begin to see, aha, now we got kids dying, pediatric deaths. Okay, there's still time to protect. Ooh, Thanksgiving's coming up. Got little brothers, you got nieces, nephews, and you got a lot of stress from tests and everything. You get the flu from somebody else. You go home. So you're vaccinating not just for you. You're vaccinating for nephews and nieces and little kids, because now is the time, okay, before this goes up. Okay, week 40. It's going to happen, okay? That's why you get the vaccine, not just for you. Okay, so what does flu cause? 3 types of diseases, okay? And each is different. Upper respiratory tract infection, you know what that is. Sneezing, coughing, and so on. It's essentially bad cold, okay? Bacterial pneumonia and viral pneumonia. Okay, so here's your normal epithelia. Okay, these are cells, got a lot of mucus in them. And then these are ones that push the mucus up, okay? Unless you're a smoker, then they don't push mucus up and you get a lot more viruses and bacteria in your lungs. Okay, so that's normal, okay? And so when you get flu, it feels bad for a few days, really bad, and then you start getting better in about a week. Kids, now they're the ones that spread it longer, okay? So that's why they were targeting kids in school, okay? Because they're the ones that give it to adults. Okay, one other issue with getting flu is ear infections. Screaming kids in the middle of the night going to pediatric after hours to get antibiotics, ear tubes, on, because you get a virus, okay? And the virus goes in your eustachian tube, the place between your ears and your throat, okay? And kids, instead of having eustachian tubes like this that drain the fluids down in the throat and swallow like we do, theirs like this. Okay, and so what happens when you get flu? Boom. All those ciliated hairs on those cells are dead. That's what influenza infects. Okay, so then you get the bacteria growing in there, nice and warm, 37 degrees. Okay, the next disease you get is bacterial pneumonia. Okay, so you get flu, feel bad, start to get better, but then remember what happened to those ciliated cells? Now you got the bacteria down in here in your lungs. That's what pneumonia is. Boom. Antibiotics right away. Okay, that's why you get antibiotics with a viral infection. Okay, you saw those cells get desquamated, destroyed. Bacteria goes down. You breathe. You don't want to run. You do not ever want to get outside and run. Okay, and get the virus down in your lungs. You're sick, stay home in bed. Okay, that's when you get antibiotics. Okay. Viral pneumonia. Viral pneumonia. Just get sick. Okay, so the virus now is in your lungs. Why does virus get in your lungs? Well, you're going outside running, it's colder, and guess what? Temperature of the virus replicates at about 33 degrees, not 37 in their lungs, which is again why you stay home when you got a viral infection. If it gets down in the lungs, here's a nice little red blood cell. And this small little place here is between the air part of your lungs and your capillaries. Okay? So if the virus replicates here, you die. You die because the fluid comes out of here. And the story that Dr. Small says, pregnant woman, you got more blood, you got more fluid. She's 23 years old, never had a flu vaccine or didn't have the antibodies for that particular one. She died, the baby died too. She drowned, okay? Now, the neat thing is if you got antibodies in your blood because you got the vaccine, IgG is in that's the shot or the flu miss, okay? You'll live because you got antibodies, the virus won't break those cells. Another reason to get the flu vaccine. And you can get the shot if you're pregnant. Okay? A woman in her lab pregnant, she got the flu shot, inactive, not the miss. So there are several vaccines, the trivalent inactive, the shot. There's a live attenuated one, that's the one for the kids. Okay, and they got all of these particular H1, hemagglutinin, neuraminidase, H3, N2, and influenza B. There's another one out there, ta-da, an advertisement for baculoviruses. Okay, it's egg-free. Okay, so it's a recombinant one. So you put part of the complement to the H and the N in a baculovirus. You infect caterpillar cells, okay, with no bovine serum in them. You don't have that animal tissue in there. And after the baculovirus replicates, it makes the hemagglutinin neuraminidase. You can purify those proteins, and that now it's got a lot more of the protein than the traditional flu. It's called Flu Block, and it was made right up the street where I used to go skiing in Connecticut. Okay, pretty neat thing. And the guy that got the patent got $30 million in royalty. I didn't get that much. Okay, so again, who should be vaccinated? All children 6 months and up, plus adults, that's you guys, against flu with either the spray or the shot. So when do you start going from spray to shots? Okay, so people that are about college age, older people who are in college, you get shots. But younger ones, I had to lie about this. I was over the 49 age, but I really wanted it. And I was so nervous. I was shaking because I was lying about my age, but I really wanted one. Okay, so I got it. And it's fine because it protects you against the upper respiratory tract infection. The spray does. This prevents you from dying. So people say, "No, I got the shot and I got sick." At the barber shop, I always talk about viruses. Yeah, I got the flu shot and I got sick. And I go, well, it worked. You're alive. Remember the airspace there? The IgG protecting the lungs from bursting and drowning? It works. Okay, you may get sick. You're not going to get deathly sick. This one, you may get sniffles and so on. So what? Most of us get allergies and sniffle a lot anyway. Okay, see the difference there? Okay, so if you have to lie once, it's okay. It's okay to lie. Okay. And again, the live attenuated, the flu mist, again, they've done work, New England Journal of Medicine's better for children. Cannot cause flu, the inactivated one, for two reasons. One, it's inactivated. Number two, you put it in your muscle. Where does flu multiply? Epithelial cells, not in muscle. It cannot cause flu. So when somebody says, I got the shot and it gave me the flu, no, you tell them, no. Let me tell you what, no. Facts, people don't like facts, except for me. So it only produces IgG. Again, this is, you have to change every year because of that. Okay. TIV have been trivalent inactive, has been more effective for adults. We've seen flu, we've gotten flu, and so we get the flu mist, and we probably won't multiply it enough to get a good coverage. Here's why this shot has to be changed. So you can see the different proteins on the surface, the hemagglutinins, change regularly because they come from Asia, because people are there with their pigs and ducks and so on, and so we get different ones. H5 doesn't really go between people very well. It's mainly in birds, but can go from one person to the next, maybe. Okay, some of these up here. Avian influenza is economic, so they kill chickens by the tens of millions, okay, to prevent the flu from spreading to other growers. Okay, so what did Grandma say to do if you have the flu? Drink lots of fluids, right? Why do we have to drink lots of fluids? What happens to those epithelial cells? You want to make that mucus thinner. Really, that's really what it's about. Make your mucus thinner to get it out. Okay. What else Grandma say? Anybody have a grandma?
Chicken noodle soup.
Chicken noodle soup. And as Dr. Small said, I don't know why. However, I would substitute anything that's hot. Okay? Again, if you can keep it hot, that's good. Rest, because what happens, you don't want the virus down in your lungs. You should stay home and rest. Don't give it to other people. And stay in a warm room. If you could, go to a sauna. My neighbor, when she was alive, she had this nice little sauna, and I got sick, and I said, could I go over there? Got it. So you want to stay in a warm room, not just cover up here. I'm nice and toasty. No, it's right here. Okay? Virus multiplies at 37 degrees. Ooh, guess what the attenuated vaccine replicates at? 33 degrees, right up here, not down here. It's mutated. That's why it's live attenuated. Okay, so what happens when you give parents a choice? You don't have to vaccinate. So Japan is a perfect example. So there was 57 epidemic, 8,000 people died. They jumped right on it. So vaccine, school children begins. So it came down. Okay, and then it became mandatory, and it goes down, down, down. And then we're not seeing, just like polio. Nobody gets polio. We don't need to vaccinate, right? Until they go to Afghanistan and so on. But then you can refuse vaccination, not for religious reasons, just because you're adamant you don't want somebody to tell you what to do is probably why people say that. Okay, and so look what happens when the program is discontinued. Okay, deaths from all causes, okay, versus excess deaths attributed to pneumonia and influenza. They go back up. So that's what happens with any vaccine preventable disease. We had whooping cough here in Florida. My first graduate student's a state epidemiologist, and he was just ranting and raving about parents not giving their kids the whooping cough vaccine, getting croup. Okay, so what can we do here? What is the take-home message? If you can immunize 70% of the kids, you're going to protect everybody, okay? But how do you do that? Well, you got to do it in schools, okay? What happens? The least bad time was 86 and 87. The worst was in. So the illnesses were 2,800 and the least bad, 35,000 and the worst, okay? So yeah, you're feeling bad and so on and on. But what does that add up to? Okay. Hospitalization. Okay, so if we immunize all those kids, we can prevent and save that many illnesses, anywhere from 2 to 30,000. Not 100%, but pretty close to it. We can reduce hospitalizations, we can reduce the number of deaths, okay, and we can save money directly, close to $1 million, and it doesn't cost anywhere near that for the vaccines. And indirect costs, not going to work, daycare, getting somebody, you know, you can't go to school, who's going to teach the class, what am I going to do, you know? And so there's a lot of other costs associated with it. So ideally, and we are doing this here in Alachua County, is we're vaccinating, it was 60+% a couple of years ago. I'm not sure what it is now. But I had to go in front of the, I don't know if it's city or county commission, and tell them about this, how much money could be saved. And they ended up funding for 10 years vaccine programs in schools. So we are saving money, hospitalizations, deaths of grandparents, deaths of infants, because we're keeping the spreaders. You saw the school-age kids are the ones that keep the virus longer and higher amounts than other people. Okay, so the flu mist is right there. In the nose, the live attenuated one, okay, is kids prefer that to getting shots, okay? And even works better when the virus changes from year to year, okay? And this is where you got to know a little bit of immunology. Okay, IgM is the one that shows you've got an infection now. Okay, so if somebody gives you a virus, you're going to say, you gave me this. Oh, no, I didn't. So, yeah, I got IgM. How about you? I got IgG, is the one that stays around a long time. But IgA is in our mucus and in our tears and in the vaginal secretions. Okay, so IgA is good in that regard. So it's very protective. How come somebody didn't ask me, how does the HPV vaccine work? Ooh, it's not a live attenuated vaccine. I learned this from a medical doctor, gave a lecture from Denver, Colorado. Okay, turns out females are kind of different. Okay. You do something that guys don't do, except in the lungs. Remember, your lungs are protected, but that's right there at the blood interface. Women have what's called transdermal IgG. So if you get a shot, you're only producing IgG. That's how you get protected against HPV. Then why do they want it for guys? Oral sex. Okay? Remember Michael Douglas? Had he gotten the HPV vaccine, he might have been protected. Okay, so again, it works. New England Journal of Medicine says it works. Okay, so did I preach too much? So when people tell you they don't believe in vaccines, you say, do you believe in protecting your mother and grandmother? How about your nephews and nieces? That's really why you want to get the vaccine. If you get sick and die, you're going to die, you know. But you're protecting other people too. And you're saving money, okay? And so you're saving a lot of hassles with, oh, I'm sick. What am I going to do with my kid? Who's going to, you know, the kid's got to come home from school. I got to go to this meeting. I got the, so it's more than just refusal because the county said I got to take my kid and get it vaccinated. No, we're really protecting others too. And that's the way I like to put it, is you're being unselfish by getting a vaccine. Okay, and like I said, who wants to be sick? I don't. If you got a vaccine, be great. Any questions? A lot of people come and talk to me afterwards up close. Say, Dr. Maruniak, yes?
Vaccines are updated every year. Is that a standard procedure? Is that just something that because the viruses do evolve, they do need new vaccines?
Yeah, so the question is, do you need to get a vaccine and kind of why you need to do it? Is it a standard procedure? So I got the flu vaccine here in North America. I went down to Bolivia, and guess what? I got flu really bad because it was their winter down there, or it was a different time of year. And so there was different strains circulating. So remember, the virus comes from ducks and pigs.
Right.
Okay, so they got 8 segments that are reassorting, kind of like shuffling cards. And so now you've got hearts and clubs that shuffle, and all of a sudden the club is the one that really whacks you in the head. Okay, but every year that happens. Okay, obviously viruses want to multiply to continue on, and they do, and it's because of that, and because the RNA viruses don't correct the mistakes as they're making copies of themselves. You get those little changes that drifts, and that's why the live attenuated one is better at handling those that change a little bit versus the ones that shuffle. You're going to get sick unless they predict correctly. Yes?
I know a family that has 6 children and they homeschool them, so, and they don't immunize. But I guess you're not forced to unless you are sent to public school, right? So I don't know what happens to, I mean, I guess eventually if they go to high school or college, they'll have to, but.
The 33-year-old man, chicken pox, in a wheelchair. My brother, get out of medical school, 3 weeks, don't come back. He missed a lot of it. Or the 3-year-old who died. Okay, yeah, let's have a chicken pox party. Okay, who wants their 3-year-old kid to get chicken pox and die? Because this is how we did it in the old days. Okay. Yeah, but how many people actually died? You know, who had cross-eyed because they didn't have the measles, mumps, rubella vaccine when my cousin. Okay, so yeah, homeschooling sounds cool, but
But they can still get it. I don't know why they're smart people, it's not that, it's just, I don't know what they have.
smart is one thing, but educated is different. Okay, you can have an incomplete education, which we all do. We all have, you know, And the other thing is, we all know, let's go out and exercise, let's eat right and everything. So people's ability to change, that's a big problem, because we get stuck in our habits. Okay, and so if you're, well, let's look at the clerics saying, we're not going to vaccinate because we don't believe that you're protecting us. Look how many died, look how many got the measles, okay? 10 times or more, as the Christians said, come on in, vaccinate. Okay, so the religion is part of the issue. But all you got to say is, you know, we've Googled the Bible, and it's not in there, okay? It's not there. So, you know, you're feeding your kids good food. Why? Don't feed it. Let them go out and just forage. It's kind of like saying you shouldn't get a vaccine. Yeah, they can survive. People can survive on very little. But, you know, the educated person wants to protect. Maybe they got too many kids. If they had one. My parents had 6 kids too. We all got sick. But, you know, to think about it, the more kids you have, the more, well, my grandmother kicked out of the house when she was 13 or so from the Ukraine. Go get a job. Well, she did. She came to the United States without her parents. Never saw them again. Things were different, you know, so I can understand cultural things are different, but I don't know. Like I said, it's not religion. I checked. I did. I checked every one of them. So it's stubbornness. It's stubbornness. And here's the other issue. When you're trying to argue with somebody, if they're wrong about one thing, then their whole belief system crumbles. They don't want to do that. So for me to convince them you're protecting your kids, then they got to say, oh man, maybe I'm wrong about homeschooling. Oh my God, my religion. Oh, my political party. You know, that's really the slippery slope of human extrapolation, I guess is what it is. You don't want to be wrong about anything. That's why we got so many issues in human behavior, is you just get stuck. And so, like I told you at the beginning, I don't want to preach and proselytize, but I am. But in a kind of different way. You guys are educated, and you want to learn more. But the other thing, you probably want to help others too. And so now your task is to go out and preach to others and to say, let's go get the vaccine. Because Thanksgiving's coming up, and I don't want to give it to Grandma. Okay? Anything else? Yes?
I just have one piece of information. I was researching influenza because I have a presentation tomorrow, a little bit about it. And actually, in Alachua County, we're one of 7 counties in Florida right now that it's widespread. It's not widespread, it's moderate. There's only 1 county that's widespread right now, but we can get to that part if no one gets their vaccine. So we may plateau, we may not. The information on the floridahealth.gov is kind of, you know, it depends on us to get the vaccine.
She told you to get the vaccine because it's out there. Yes?
I was just wondering, how long do vaccines work?
How long does...
Chickenpox vaccine, how long does it work? If you got it when you were 15, will it still be okay?
I don't know how long it works, but if you've had the vaccine, you're not going to die again. Okay, so you have the memory B cells are going to produce antibody, unless you probably get old, like my dad, he got shingles. Okay.
Any of them, like mumps, anything? Do they? Because some vaccines they say you should take, like for meningitis, you take them more often. Yellow fever every 10 years.
Yeah, actually yellow fever should be lifetime. When I was up at Yale where they made it, they said it's good for your life. But countries say, but yeah, if you're going to a place, for instance, if you're in the military, you're a healthcare worker and you want to go over to Afghanistan or you want to go to Haiti after earthquake, you probably want to get vaccinated with boosters, not just for the bacterial problems, but also for some of the viral ones, measles perhaps. But yeah, and this even happened in the Soviet Union when it broke up. They were getting polio. And, you know, the communists, you have to get the vaccine. There are no exemptions. You got to do this. We're going to put you in jail. You know, I'm exaggerating, but, you know, dictators, you have to do it. Okay? But they were getting polio. They got high cases of HIV, IV drugs. Okay? So, yeah, once the healthcare system breaks down, then those old diseases, measles is so efficient at spreading, it's respiratory. All it takes is one virus particle. It takes about 50,000 HIV particles to get you HIV. A couple of hepatitis B. So each virus is different. Flu takes a couple. So. Yes?
You know how when you gave the example of a child having like 4 vaccinations like in one day and then they had to go back, wouldn't taking 4 or getting 4 shots of different vaccinations, wouldn't they counteract with each other? Or?
Okay, so the question is, if you get 4 different vaccines at the same time, is there going to be a problem in actually producing a good immune response? So far it's working. So yeah, that is going to be a little more painful. Okay, but yeah, your immune system is going to get turned on and work. It works. So it's either that or which of those 4 do you want your kid to get when they go to daycare? You don't know where the people came from. You know, they could have, a professor from some country where there's measles, okay, and they come here, the kid has measles, they didn't get vaccinated because they're homeschooled, and your kid there, you know, those are types of far-fetched, but they do happen.
So they do it at the same time just because it works and they don't?
Yeah, you're trying to protect them at that early age when they're most likely to get it from other kids. When I got them, you know, like I said. And the thing with polio, I may have gotten polio because my best friend, I'd go over to his house and his brother's the one's in a wheelchair, okay? You can, 99 out of 100 people get the virus, goes in, get a good immune response. The 3 in my department were the unlucky ones. Yes?
So, in the case of vaccinations and people's beliefs, people's beliefs, how can we, I guess, persuade them, like if they strongly believe that giving them the vaccine can cause autism, or maybe that's why the family is not getting the vaccines because they have read about
Or
things.
the student who's going to be giving vaccines, she was in a program to give vaccines, and you saw her belief system makes you infertile, so on. So when you're trying to convince somebody to change their religions, pretty tough, right? Change political parties, pretty tough. When you're trying to convince them to change their smoking habits, tougher. Drinking habits, so, or anything associated with health. Number one, you got to be really good and close with them. And you can't attack them. Facts don't change behavior. Knowledge does not change behavior, as you know. You got all the knowledge, everybody sees the knowledge, but changing behavior is something that psychologists work on. And how they do that, there's a book I read, Don't Shoot the Dog, by Karen Pryor. She trained the killer whales and dolphins at SeaWorld. And until recently, you could get your head in the mouth of a killer whale. You could rub its tongue. You could ride on it. By shaping behavior, little by little, positive reinforcement. So, okay, your kids are going to be going to college, okay? There are people out there that have these diseases. Now might be a good time. What do you think? No, I don't want to do that. I know you don't want to do it. But, you know, what happens if they end up in a wheelchair? There are cases that's happened. You'd feel pretty bad, wouldn't you? So you work on them little by little to change somebody's attitude about things. Changing culture is the hardest thing to do. You just can't tell somebody, you got to stop doing that. That's why Ebola is widespread. You know, your mom dies from Ebola, and your job as a daughter is to wash the body, take care of it, wrap it up. And guess what? You're going to get Ebola and die too. But that's part of their culture, taking care of your relatives in death, which, you know, if your mother was dying, you'd want to take care of her too. You know, so to change that type of, you know, I'm not going to vaccinate my kids because it's dangerous. Let them come to my lectures. You want your uterus removed and not have kids? Here's a picture. Ta-da! You want to have cauliflower where it shouldn't be? Ta-da! Oh, but they're not going to have sex. Oh, I got other stories I can show you. Promiscuity. I cleaned up my lectures, okay? But yeah, I'm pretty brutal when it comes to who's at risk. That's the most important thing. If you know you're at risk, you're more likely to change your behavior. More likely. Okay, so that's why I talk about gender, race, orientation, religion, so on. You have to let people know they're at risk, and then they make the decision.
Any other questions?
One more question.
One more.
Yeah, so are you part, or are you still part of the program for allowing to vaccinate the kids at school? We have to thank you that because I am very happy with that the vaccinating the flu means at school.
Yeah, I'm not part of it, but one of the former presidents of the virology club that I advised, she was very instrumental in doing that. But she's gotten out of the program. 3 more months, her PhD, and I think she went up to CDC and interviewed for a job there. But with Dr. Small, yeah, is her PhD. 80 years old, coming lectures. Guys, just I drive by, drop off the kids at 5:30 in the morning, the 300 Club across from Westside Park. He's got lights on in the room where he does his computing. I've helped him with some of his PowerPoints. 80 years old, still working. We got a guy in my department, 85, goes out in the natural area, 7:30 in the morning. So there's, you know, there's plenty of life left in us older folks.
So, thank you very much.